So my little research on health insurance. Let's say I'm paying $200 a month each month. So in 12 months, I would have to have spent $2,400 a year just to have health insurance. A lot of times they have an annual deductible. That means, for example, this one I put as an example that it's $2,000. That's the amount of money I have to pay before insurance will begin helping to pay. This covers mostly what I saw are like emergency situations. For example, if I broke my arm or I had an emergency accident, needs surgery, everything. Let's say my bill would have come out to $20,000. Then I would have had to pay $2,000 of my own money until the insurance begins helping me pay. They don't cover this whole $18,000. I had to pay 20%. That's what co-insurance is. I had to pay 20% of this bill, which is $3,600, before they pay the rest, which they will cover the 80%. That's $14,400 that they would be paying, which is great if I have an emergency. I still, however, have to pay the copay from the ER visit that I went there. And if I stayed there maybe 4 days for the emergency that I had, I still have to pay the copay of $250 per day for being inpatient. This copay is not covered in my It's not added towards my deductible. So this is a different payment. I still have to pay that. The good thing is that the insurance have an out-of-pocket maximum. So this is the amount that I will pay up to the amount that I will pay. For example, right here I showed you guys that I'm paying $2,000 for the deductible and $3,600 for the co-insurance. However, because it goes over the out-of-pocket maximum, it's $5,600 adding both. I'm actually only paying $5,000 total, and the insurance will be covering the $600 and anything after that. So they do cover this 80%, and they would cover the $600 after that. The copays, from what I was researching, the copays do not go towards the deductible, so you are still having to pay all the copays. For example, I went to the hospital. I had to get there in an ambulance. I still had to pay that $150. I had to pay the ER copay. I had to pay the labs, the MRI, all these copays I still have to pay. And those 4 days that I told you that I stayed in the hospital, I have to pay $1,000 for those 4 days. If I get prescription, like pain medication, because I broke my arm, I would have to pay $15 or however many refills I get. So these are the charges that I'm responsible for. This is the monthly payments for the year, $2,400. This is the maximum out of pocket that I would be paying. And anything else, if I have to follow up with a medical doctor, if I need any specialty coverage or visits, it's $35. So these are my little notes about understanding health insurance. The only thing I think I wanted to add was that this is great if you have an emergency, but if you don't, you're always going to be paying the monthly payments, $2,400, which if you don't use your health insurance for anything, it's a lot of money. And you're still going to the doctor and you're still paying $25 each time you see the doctor. You're still paying the copay for the medication. You're still having to pay a lot of things, whereas you could have used this money and just used that towards your doctor initially, if you were to decide not to have health insurance. But now they're doing a penalty for not having health insurance, but the penalty is only $700, so some people are actually just taking the penalty instead.